The Honorable Commissioner of Health for Lagos State, ably represented here. The First Lady of Lagos State, also ably represented here. Mrs. Bamidele Abiodun, First Lady of Ogun State. Our revered Chairman of the occasion, Olorogun Sonikuku, the President of EMSON, and my own dear sister and wife on the other side, Dr. Anoma. Distinguished ladies and gentlemen, I'd planned to be here on my own right as CMD of Luth and as a friend of this association. I'm a pediatric surgeon, I'm not an endocrinologist, but I have so many years of association with esteemed members of your club, and Professor Somade would not allow me rest if I didn't come here. But I was called upon at the last minute by the Honorable Minister, who's unable to be here today. So he sends his apologies. He would have loved to be here, but for pressing issues of state. He, however, sent a goodwill message, which I will go back to. I will go on and read to you now. So, after observing all protocols, distinguished ladies and gentlemen, it's my pleasure to be in the midst of seasoned clinicians, scientists, and researchers like you at this August occasion of the 43rd Annual General Meeting and Scientific Conference of your society. The Minister says that I understand that this is the first physical meeting since the onset of the COVID-19 pandemic, and I appreciate the efforts of the federal government and the medical community in this country for putting all hands on deck to help bring the scourge under control. The theme of this year's conference, which is obesity and overweight, that theme is quite significant because it touches on a very important non-communicable disease, which is the root of many other non-communicable diseases, such as diabetes mellitus, hypertension, and cancer, and others. Obesity and overweight have a negative impact on the most productive segment of our population, the young and the middle-aged. Obesity, a form of malnutrition characterized by excess body fat, is injurious to almost all organs of the body and is a consequence of poor eating habits in childhood and adulthood. Children who are underweight or overweight are also at risk of adult obesity when exercise is inadequate, coupled with slowing down of metabolism during the later years of life, all of which lead to easy accumulation of fat. Obesity is often neglected by the general society as few people regard it as a disease entity. In developing countries, those who are overweight or obese are often regarded as showing signs of affluence and high social standing. Unfortunately, this leads to other diseases which exert a great burden on the health sector and on the family. Studies have shown that almost 2 million people are overweight and obese. I'm sure that figure is much understated. 2 billion, I'm sure the writer meant 2 billion globally. And in Nigeria, more than 10% of the adult population in urban and suburban areas are overweight or obese. Unhealthy lifestyles, urbanization, and consumption of highly processed foods among Nigerians are the main causes of overweight and obesity. To mitigate the effect of obesity on society, the federal government of Nigeria introduced tax on carbonated drinks last year, the first of its kind policy to fight the increasing problem of overweight and obesity. The new policy, now popularly called the sugar tax, is contained in the Finance Act signed into law by President Muhammadu Buhari. Currently, the federal government, through NAFDAC, is also reviewing fats and oils regulation to capture the 2% maximum limit set up by the World Health Organization. The Federal Ministry of Health is giving all necessary support and will make sure that this regulation is gazetted as soon as possible. The federal government continues the implementation of the national policy and strategic plan of action on the prevention and control of non-communicable diseases generally. This policy provides an overarching framework that enables stakeholders to combine and balance collaborative public health interventions targeting the whole population. I implore your members to study the policy thoroughly. The federal government will continue to support the management of endocrine diseases such as diabetes through the launch of the National Diabetic Guidelines. These policies are very ambitious, aiming to stem the rapid rise of NCDs. The Ministry, in conjunction with the Office of the Senior Special Assistant to the President on Sustainable Development Goals, set up the Felicia Anoma Endocrine Center and the Felicia Anoma Diabetes Centers. These centers, named after one of your esteemed members, are unique and evidence of the government's strong commitment to the health of the populace. The centers are already operational and they attend to thousands of Nigerians with obesity, diabetes, thyroid, and other endocrine diseases from within and around the Federal Capital Territory. These centers boast state-of-the-art, fully equipped consulting rooms, seminar rooms, laboratories, dressing rooms, libraries, and call rooms for medical personnel. The Federal Ministry of Health will continue to prioritize the health of the teeming Nigerian populace, knowing well that a healthy population is vital to the growth and development of any country. I therefore look forward to having a copy of the communique summarizing your deliberations at this conference, because this will help in our plans to continue strengthening the healthcare system. I assure you the continued collaboration between the Federal Ministry of Health and the Endocrine and Metabolism Society of Nigeria. Once again, ladies and gentlemen, congratulations on this conference. Thank you and God bless you.